Moderna has approved its vaccine for kids aged 6 months to 5 years old. It's the first COVID-19 shot approved for the youngest children in Canada. Joining me now is Raywat Deonandan. He is an epidemiologist and science communicator at the University of Ottawa. Good morning to you, and thanks so much for coming on the program this morning.
Good morning. It's my pleasure.
Okay, so we got to get to it. And first off, let's talk about the child size doses. How small are the doses?
Oh, the exact numbers I don't remember. I think it's like 20 micrograms, so about half or less than half of the adult dose.
That's exactly what I was going to ask you, how it compares. Now, the components to the dose is the same as that of of what we see in adults. It's just smaller size. Is that correct?
That is correct, yes.
Okay, so what would you say to parents who are somewhat hesitant to get their child the shot?
I understand. I have a child who's 2 years old, and I get the hesitation. We tend to be more protective of our children than we are of ourselves. The thing to remember is, while it's true that young children tend to do better with COVID than do adults in terms of infection rates and hospitalization rates, some do get hospitalized and some do sadly die. In fact, the hospitalization rate in the USA for kids under 6 is increasing for COVID, and that's a little scary. So this vaccine, while it has moderate protection against symptomatic disease between 37 and 51%, probably has a very high protection against hospitalization and death. That's what I care about as a parent, keeping my kid out of the hospital and anything more serious than that. So if you want that additional protection so your kid can socialize more freely in his daycare or elementary school, I think it's a good idea to get vaccinated.
Are the side effects for children due to the vaccination, are they different for children as that you would see in adults?
They're comparable. The most common things tend to be pain at the injection site and fever. For the Moderna trials, they saw about 18% of kids in the drug group getting fevers, and compared to 9% in the placebo group. So the risk of that is about twice as much. But the serious stuff people care about, the myocarditis and pericarditis, that was not observed in the clinical trials at all. So I don't think that's going to be a big concern as this is rolled out to a larger scale.
How soon can these young children get shots?
Well, that depends on how quickly they become available. I understand that they've been ordered and the federal government is distributing them to the provinces. So it depends on when you can get them locally. Oh, so in terms of age, though, they've been okayed for kids over 6 months.
This is just the Moderna vaccine that has been approved for the youngest of our population. What about Pfizer?
Yeah, so Pfizer has a submission as well, and the vaccine dosing is a bit different. Moderna uses just 2 shots, and Pfizer needs 3 shots. And the Pfizer efficacy is a little more confusing to compute because they didn't submit data for their 3rd dose. They think it's about 80% effective against symptomatic disease, and Moderna's is between 37 and 51%. I'm skeptical of the 80% number, to be honest. So the big difference, though, is that Pfizer has 3 doses and a lesser chance of an adverse reaction like fever or pain. Moderna has only 2 doses, but a slightly higher chance of fever and pain and things like that. So as a parent, you have to make up your mind whether your child is better off with the lesser risk of an adverse reaction, but more shots, or can tolerate fewer shots with a slightly higher risk of some of those uncomfortable things.
We appreciate your time as always. Raywat Deonandan, epidemiologist and science communicator at the University of Ottawa. Thank you for your time this morning.
It's my pleasure. Thank you.